What are the risks associated with the endolift procedure? The endolift procedure is safe and effective, but of course, like any medical procedure, it can have various complications. I can divide the complications into two groups. There are complications that always occur, although calling them complications might actually be quite misleading. But these are issues like swelling, redness of the skin, and depending on the patient, this swelling can last for varying amounts of time. Sometimes they are barely noticeable, or the swelling can last from a few days up to a week. Meanwhile, the redness of the skin usually disappears within a few minutes to a few hours after the procedure. As for more serious complications, this is a procedure that uses a high energy device, namely a laser that heats the skin. In doing so, we can potentially damage branches of the facial nerve, which run approximately in this area. These branches, of course, vary in location for each patient because of genetic differences, and this can happen as a result of mechanical injury. Simply by bringing the fiber optic too close to the nerve, we can damage it, or it can even happen the day after the procedure as a result of swelling, because if inflammation develops near the nerve due to swelling, it can spread to the nerve. Let me reassure you right away, statistically, this occurs in less than 1% of procedures performed in all patients who experience such paralysis. After treatment is implemented, all symptoms completely resolve in 100% of cases. There has not yet been a case where a patient's paralysis did not go away. How quickly does the paralysis go away? Of course, it depends. If the paralysis is caused by swelling, then administering anti swelling medication causes the symptoms to subside very quickly. In the case of untreated patients, because not all patients undergo treatment, these symptoms resolve after about 2 or 3 months. So when we start treatment, the symptoms go away faster. When we don't treat these symptoms, they appear later, subside later, and therefore there's no need to be afraid of this. But I always inform the patient about this risk, which is temporary. Therefore, I must tell you that compared to many other procedures, especially surgical ones as well as other lasers, recovery after the EU photon endolift laser is a safe procedure, it is effective, and it offers minimal recovery time. We also call it a so called lunchtime procedure, meaning it can easily be performed during a work break with informed consent and a conversation. The entire procedure takes about 45 minutes to an hour when performed by an experienced doctor. Therefore, as you can see, there may be very few complications. But one more thing just came to my mind. When we heat the skin, there may also be a temporary thickening of the skin. This is because the collagen fibers react very strongly to the laser beam. Therefore, to avoid this, I perform a test. It's called a stretch test, where I apply the beam, deliver it, and observe how the skin reacts. As a result, I never really know how many pulses I will give to the patient. Of course, I have a maximum number in mind, but I simply observe the patient's skin, how it reacts, and I watch for effects during the procedure. Because above all, it is very important that this procedure is effective, that it is a treatment, but most importantly, that it is safe for the patient. We want the patient who comes into our office, and usually these are very beautiful patients, to be able to leave just as beautiful after the procedure. Maybe not immediately, because there might be some swelling for a little while, but still, we want them to be satisfied. One of the complications that can also occur is skin hypersensitivity, which can last from about a week to a month. This is similar to what happens after a liposuction procedure. It is a matter of damage to the superficial nerve fibers. I like to say it's a feeling similar to opening the car window on a spring day and having the wind blow on you a bit too strongly. So it's not paralysis, it's more like damage to the superficial nerves, and it creates this sensation of excessive skin sensitivity. This is completely normal after an endolift laser treatment. One of the complications that can also occur with procedures around the eye area is swelling. Therefore, if we're considering a procedure around the eye, it's really difficult to perform it without leaving any post procedure marks. In the case of other areas, I think that even the husbands of ladies who undergo the procedure might not suspect that it has been done. It is very rare for a blood vessel to be damaged because, with the parameters we use during the procedure, the laser does not have an affinity for the water present in blood vessels. Of course, with the parameters used in aesthetic medicine. Therefore, you would really have to be quite unlucky. Statistically, it has happened to me very rarely that a patient ended up with a hematoma. The procedure is performed intradermally, which makes it a very safe treatment area. On one hand, it allows us to optimize the results because that's where our collagen fibers are located. On the other hand, there are no arteries or major blood vessels, nor nerves that could be damaged, and thus expose the patient to a longer recovery period.